Today, we're going to discuss adenomatoid odontogenic tumor. Now, the word adenoid tumor. Adenoid tumors they develop in glands. These swellings are mostly benign. They're clinically asymptomatic lesions and they're not ulcerated. Whereas the term adenomatoid tumor indicates that the tumor arises in non-glandular structures, mostly from skin, mucosa, or genital organs. Histopathologically are composed of tabular areas having flattened cells. Now, the term adenomatoid reveals duct-like structures in non-glandular organs. The term odontogenic indicates that there are lots of structures composed of cells which can form odontogenic apparatus. In this, the epithelial cells can be arranged in form of islands, follicles, strands, or sheets of cells. As the tumor doesn't show any metastasis or it is not ulcerated, so the term benign is used. AOTs are the tumors which are composed of duct-like epithelial structures, so the term adenomatoid. Earlier it was also called as adenoameloblastoma because duct-like structures are surrounded by columnar or cuboidal cells in which nuclei tends to be polarized. Again, there are lots of spindle-shaped epithelial cells which are arranged as sheets, strands, or rosette-like structures. Now, what are the clinical features? Most of these are seen in anterior maxilla, canine, unerupted teeth, females, and in the second decade of life. Earlier, it was also called as two-third tumor because two-thirds occurred in anterior maxilla, two-thirds were thought to be occurring in the canine, two-thirds were found to be found in females, and two-thirds were found second decade of life. Many of the studies and recent studies don't agree about the two-third tumor theory. According to recent studies, the female to male ratio is 2:1, twice common in maxilla than in mandible, and predominant in second decade of life. Clinically, the mass is slow growing and the consistency is bony hard. It is not a large lesion and the size varies from 2 to 5 centimeters. It is asymptomatic and not associated with pain, and in the oral cavity there is displacement of teeth and expansion of cortical plates. The extraosseous variety of adenomatoid odontogenic tumor is also seen, which occurs in soft tissues and which is solitary, painless, nodular, and asymptomatic swelling. Radiographically, the unilocular radiolucency is seen, which involves crown of unerupted teeth. The radiolucency extends apically along the root. It is not attached to the C junction as in dentigerous cyst. So, dentigerous cyst is the very important differential diagnosis radiographically. Occasionally, in this radiolucency, there are radio-opaque flecks which occur as thin radio-opaque areas. Now, histopathological features. Number one, it's covered by fibrous capsule. Number two, there are sheets, strands, and masses of cells arranged as rosettes. Number three, there are tubular duct-like structures surrounded by cuboidal cells which can have reversely polarized nuclei. Number four, the stroma consists of collagen bundles and fibroblasts. It can resemble dentigerous cyst, radiographically lateral periodontal cyst because based on the location that is in the region of canine premolar region, then it based on the consistency, bony tumor and non-odontogenic cysts can resemble AOT, and if AOTs are large, then ameloblastoma of anterior region can be the differential diagnosis. Lastly, coming to the treatment, the enucleation is the treatment of choice because it is covered by prominent capsule. The recurrence is very rare and prognosis is good. To conclude, the multiple choice questions AOTs are here. Option number A is correct. They form only 3 to 7% of all odontogenic tumors. AOTs are not very common lesions. Again, they are not very rare and they are odontogenic tumors. Question number 2, true about AOT. Here, they are more in females. They are more in maxilla. They are more very young patients, and option number D is correct. They are more in canine region. AOTs are mostly asymptomatic. Option is correct. Option is B. They are not associated with pain. They are radiolucent and they don't recur. The recurrence is very rare. AOT radiographically resemble dentigerous cyst because the rest of the lesions have got either radiopaque or mixed radiolucent radiopaque appearance. False about AOT, that is false. The false option is A. It is a recurrent lesion. The rest of these options, it is a benign lesion. Yes, it has good prognosis. Yes, it is covered with capsule. Correct option. AOT histopathologically has got rosette-like structures. It has got duct-like structures. So the word adenomatoid. Then there are foci of calcified areas. So option number D, all of the above is correct. Thank you.